Temporomandibular joint or TMJ joint. The temporomandibular joint is a synovial modified hinge joint between mandibular condyles, mandibular fossa, and articular tubercle of temporal bone. Allow opening, closing, protrusion, retrusion, and side-to-side movements. Articular surface covered by fibrocartilage, not hyaline cartilage. Components: mandibular condyle, articular eminence, mandibular fossa. Articular disc divides joint into upper compartment, gliding movement, lower compartment, hinge movements. Articular disc, fibrocartilaginous, biconcave structure attached to capsule. Medial and lateral poles of condyles posteriorly connect to retrodiscal tissue. Bilaminar zone. Function: shock absorption, stability, smooth movement. Capsule: fibrous capsule surrounds the joint attached to temporal bone margins. Neck of mandible lined internally by synovial membrane. Ligaments: lateral temporomandibular ligament strengthen capsule, prevent posterior dislocation. Sphenomandibular ligament from sphenoid spine of lingula. Stylomandibular ligament styloid process angle of mandible. Accessory ligament limit excessive movement. Muscle acting on a temporomandibular joint. Elevation closing masseter temporalis medial pterygoid. Depression opening lateral pterygoid suprahyoid muscle. Gravity assist. Protrusion lateral pterygoid main medial pterygoid. Retrusion posterior fiber of temporalis deep masseter. Lateral movements alternate contraction of pterygoids. Bursa. Two bursa are not prominent in temporomandibular joint. Functionally, the upper and lower synovial cavities act as a bursa, allowing smooth gliding. Occasionally, small adventitious bursa may develop around the capsule. Blood supply: superficial temporal artery, deep articular artery, anterior tympanic artery, mesenteric artery. Nerve supply: from mandibular nerve of trigeminal or mesenteric nerve, deep temporal nerve, auriculotemporal nerve. Movements: rotation, early mouth opening, lower compartment. Translation: wide opening, protrusion, upper compartment. Combines produce full jaw motion. Common pathologies: temporomandibular disorder, pain, clicking, limited opening, muscle spasm or disc displacement with reduction, clicking sound, without reduction, locking. Osteoarthritis, degenerative changes, crepitus, stiffness, rheumatoid arthritis, inflammatory involvement, deformity and pain, ankylosis, fibrosis or bony fusion, restricted opening, dislocation or subluxation, condyle moves anteriorly to articulate eminence, myofascial pain syndrome, trigger points in masticatory muscles.